Asthma is often misunderstood. I think the word asthma sometimes causes fear. The other myth is a lot of people feel, why should I use the diagnosis in children particularly? Because children, they just grow out of it.
Yeah.
There is a lot of epigenetic influences and environmental influences, which can make your symptoms persist, even if you are genetically not supposed to. Unfortunately, some of this is based on what resources you have.
Welcome to another episode of Woman Ki Baat. Today we have with us Dr. Sankaran Krishnan, Board Advisor at Altrus HealthCare, Chief Pediatric Pulmonologist at Boston Children's Health Physicians, and Professor at New York Medical College. Today, in conversation with him, we'll try to bridge the gap between global innovation and the local realities in pediatric care. Welcome, Dr. Sankaran, on Woman Ki Baat. We are really happy to have you here.
Thank you.
So, Doctor, you have practiced medicine across the globe.
Yes.
What are some of the global practices that you really wish to see in the Indian healthcare?
Right. I think there is a lot of advantages in Indian healthcare. The doctors are very good. They're very well educated. They have the knowledge of a lot of the newer systems and newer techniques that are available globally. Yeah. But what sometimes lacks is the accessibility to some of the more advanced treatments and medications and equipment because of cost. And that sometimes is a barrier. Case in example is if you look at some of these severe conditions like cancer or even lung conditions, which is what I primarily do. There are so many medicines and therapies currently available in the Western world, which we don't have access purely because of the cost.
Yeah.
Now, what happens is, even though we may have in India the knowledge about these medications and how they work, unless you start using them on a regular basis, you don't gain that experience. So that sometimes becomes a barrier. But otherwise, as far as humanistic approach, as far as looking into the causes and with the technology and the resources we have, I think the doctors here do a really, really good job.
Yeah, I mean, that's a good point you bring up. Like, compared to the other hospitals which are here in Dehradun, how is Altrus making that difference?
So, Altrus, in fact, one of the philosophies of Altrus is patient-centered. So, patient is the center of everything. We want to make sure that any patient who comes through our doors gets the best care that we can offer in a very humanistic way. It was when Altrus was first founded. I'm actually on the board of Altrus. Yeah. And one of the things that attracted me to be on the board is the fact that we're going to do something different. Unlike many corporate structures, the mission of this hospital is not to be a financial entity, but to be a medical entity. But at the same time, give the best level of care possible, using the best equipment, using the best resources and techniques. And that is what I think sets it apart from other corporate hospitals. Now, this is not to take anything away from any corporate hospital, but the basic philosophy is a little different. And that's what I wanted to emphasize.
We put people first.
Absolutely. Patient-centered care.
Patient-centered care, correct. So you're a pediatric pulmonologist. You see a lot of asthma patients, a lot of asthma amongst children. What are some of the signs that early signs that the parents miss? So,
asthma is often misunderstood. I think the word asthma sometimes causes fear. And by the way, this is true globally, not just in India. It is true globally, even in the US where I practice. There is a fear of using the word asthma. Somehow it gives a connotation that it is a chronic illness. And it's almost like how a child, when you grow up, you play hide and seek. And if you just close your eyes, you think nobody can see you. Yeah. In the same way, parents and sometimes even doctors don't use this diagnosis because they feel that it gives a negative connotation. Very often, instead of diagnosing asthma, Other things are used as euphemisms just to reassure parents because they get scared. So they'll say you have got a form of allergy, or you've got dust allergy, or you're reacting to smoke, or you have chronic bronchitis. But they won't use the word asthma. So this has been a problem for years and years. I even remember, this is many, many years ago, and I'm not sure, Priyanka, if you have even heard of this. There used to be a condition called eosinophilia, a tropical eosinophilia. And this is going back maybe 20, 25 years ago. Patients used to routinely get diagnosed with this condition and get treated with antihelminthics, things that you use to kill parasites. When they had asthma, there was somehow a feeling that if you have got a chronic cough, you've got tropical eosinophilia.
Okay.
And so that, of course, now has come down. It is not that prevalent. But this has been a problem for years and years that people don't want to call it asthma. Now, sometimes some doctors will even prescribe medicines that are used to treat asthma, but will still not call it asthma.
Okay.
The other myth is a lot of people feel, why should I use the diagnosis in children particularly? Because children, they just grow out of it.
Yeah.
So this is actually not true in all circumstances. A small subgroup of children, the symptoms get better as they grow older. And therefore, some doctors might feel, why burden the parents with this diagnosis when the child is going to get better by himself or herself? But it is only in a small subset of patients. And there are some risk factors, which if you have those risk factors, you are less likely to have symptoms in later life if you don't have those risk factors. And if you have those risk factors, then you're more likely to persist in later life. So if you have other forms of allergy, if you've got certain types of eczema, if one of the parents has a history of asthma, if you've got food allergies, then you're more likely to persist. And if you don't have any of these risk factors, you're less likely to persist. And this is from a genetic perspective. But what complicates matters is that there is a lot of epigenetic influences and environmental influences, which can make your symptoms persist, even if you are genetically not supposed to. So one of the triggers can be pollution. So even if you are genetically less likely to have asthma in later life, if you're exposed to environmental influences, an example is pollution of any kind, indoor pollution, outdoor pollution. And nowadays in many big cities, particularly in North India, in the Delhi, Punjab, Himachal region, when the air quality is poor, that can persist for months together, you can actually get permanent damage, particularly in young children. And their symptoms can persist just because of that. So this is a real issue. It is not just a temporary issue of being exposed and having a cough for a few days or weeks. But it can actually cause changes which can persist for a long time.
Yes, sir. So you've mentioned some really grave issues which we are facing right now. As a mother myself, children can't wear, like my child is really young and she can't wear a mask all the time. And, I feel really bad that I have to send her out I can't keep them indoors. It's not like the pollution is better indoors anymore. But, when you send them out, you really worry. So what are some precautions that new mothers, with like very small, like infants, what are some precautions that they can take, in this current environment, which is full of pollution and particulate matter, which is all very unhealthy for your lungs?
Yeah. So this is a real issue. Unfortunately, some of this is based on what resources you have, right? Wearing a mask may not be practical, especially with very young children. So something that you can control is your indoor environment if you have the resources. Outdoor environment you cannot control, right? So indoor, if you have ability to have enough circulation of air using air conditioning systems, if you put an air purifier in place, particularly with a HEPA filter, that will take out most particles. Good HEPA filters will filter out particles which are even less than 1 micron, which are the particles. I'm sure you've heard about, with all the discussion on pollution, about particulate matter and PM10 and PM2.5 and PM1.
VOCs, PM1.
VOCs are volatile organics which are separate from pollution. But when we talk about air pollution, mostly from, for example, in the north, from burning crops. It is more the PM 2.5 and PM 10 particles. Those are clearly filtered out by HEPA filters.
Okay.
So if you have an air purifier with a HEPA filter, and if you have air conditioning running, you should be okay. But see, it's not practical. You cannot be indoors all the time.
All the time.
And what if you don't have the financial resources to have an air conditioning in your home or a filter? Okay. That's a problem. That's why you need policy level decisions. That is why you need to have at a much bigger population level how to ameliorate this air pollution. And I must say this is not just unique to North India. There are different parts of the world which is struggling with this issue now.
Yes.
But this is a much larger discussion, and it is at a policy level how you can control things that can directly lead to air pollution.
Yeah. So would you like to share any personal story that you've encountered with a patient that has been really close to your heart?
Okay. I have been practicing for many years now, and I have numerous stories. I'm not even sure if I can pick on one specific one. So as a pediatric doctor, particularly a pulmonologist, we deal with children from the time they are in utero. They get diagnosed with certain abnormalities during pregnancy itself. And then right from the birth time, we are consulted to give opinions on when that surgery needs to be done. And I have had examples of parents who have lived through that crisis. And then as they get, after birth, there's a lot of congenital disorders and chromosomal disorders which affect lungs and lung circulation and lung structure even. And we deal with those kinds of patients. And then there are some genetic conditions or disorders like cystic fibrosis and some other chromosomal disorders which cause long-term lung disease. And then we have asthma and other diseases that come up in later life. So I probably have stories of every one of these conditions. I'm not sure if I can pick on one specific interesting story. I do remember some years, for a brief while, I was trained in the US, but for a brief while, for about 2.5, 3 years, I practiced as a pediatric pulmonologist in Chennai.
Okay.
This was in the late 90s. And I distinctly remember this child who the parents were convinced had cystic fibrosis. And they sought me out and came to me. And they were told at that time that cystic fibrosis is a Western disease and it doesn't happen in India. And the child definitely had that condition. And they were so grateful that at least they had a diagnosis. And they were not that resourceful. So now, of course, the scenario even in India has changed. A lot of the medications and a lot of the treatment strategies for cystic fibrosis are available. And a lot of patients are diagnosed and treated. But that one family stood out because both parents were doctors.
Oh, wow.
And they were not in Chennai. They were in Kerala. And I cannot tell you the name for obvious reasons. But they traveled and they sought me out and they started the treatment when the child was 6 years old. When she was 22, I got a wedding invitation, which was mailed to me. I was in the US at the time from this family, inviting me to her wedding. And she was still doing okay. She obviously had health issues, but she had survived. The parents had done whatever they could to optimize care. All their savings, everything that they had earned, they had put it into this child. But I was very touched when I got that wedding invitation after all those years. When I first saw her, she was maybe 8 or 9 years old.
Wow.
So
that must be so fulfilling.
Yes. So that's an India-centric story. I have many stories of my practice in the US, but I don't think our viewers need to hear all that.
Yes. So, Dr. Sankaran, how do you see these global innovations translating into the healthcare system in India, especially in Dehradun?
So, yes. So what has happened now is technology is front and center of everything, right? I mean, the buzzword is artificial intelligence.
Yeah.
But, before we even get there, the fact that knowledge has become so easily available, there's it has got its pluses and minuses, of course. I mean, I remember there used to be a time when we used to talk to patients and they would say, I looked it up on Google, and everybody becomes like a Google doctor. That has actually expanded. But one of the things that has happened is it's also empowered patients to learn and read about themselves and know about their care. But as far as global innovations go, because of this quick exchange of information and the ability to even do things like video consulting or even video surgeries now, learning has accelerated. Somebody sitting here in Dehradun can watch a surgery being done in Massachusetts, in the US, and learn techniques. A lot of new technologies have arrived, including robotics and surgery, which makes things more precise. And the learning curve for this is rapidly accelerating, which will help get these global innovations out here. And artificial intelligence and the use of machine learning to quickly diagnose conditions and to find right therapies is also accelerating. Now, as far as Dehradun itself, I think these innovations are knocking on the door. It's not going to be long before we'll be able to leverage many of these innovations and technologies sitting right here in Dehradun. And Altrus is actually committed to this. Our founder, Manish Krishnan, is himself very experienced in these areas. And one of the things he wants to do is to bring these concepts and these technologies here. So even though Altrus is state of the art and we have everything here that a patient might need for their care, these other global technologies will also be available. And that will help patient care right here in Dehradun.
Oh, wow.
This is already happening and it'll continue to happen and accelerate.
Wow. So Altrus is really upping the game when it comes to technology and providing for its patients.
That's correct. And several of us who are part of this organization, whether we are on the board or as advisors, we are committed to these concepts and doing what we can to bring these technologies to Dehradun and to our patients.
That's lovely. Just a last question, Doctor. So given the current climate, the pollution, the rise in allergies and viruses, as you said, H1N1, COVID, various versions of COVID, and so many different kinds of, new virals that children pick up nowadays. What advice could you give to the parents? Some precautions that they can take, some precautions that new mothers can take, that mothers with some little older children can take?
Yeah. So I think you started off by talking about viruses. Yes, there are a lot of new viruses coming, but I think more importantly, there is recognition of many viruses that were already there. We didn't have the technology to detect them. Now we do. Particularly after COVID, the ramp up of technology towards identifying viruses has rapidly increased everywhere in the world. And definitely in India and certainly in Dehradun, we have that ability now. Like for any condition, prevention is the best cure. So my advice would be try to stay away from sick environments, try to stay away from crowds. We talked about pollution already. Vaccinating your children is very, very important. There are vaccines available for many diseases, not all, particularly some viruses which are more ubiquitous. We don't have vaccines for those. So I think avoidance is the key. Keeping general health up to date is the key. Making sure children have good nutritious food. And getting advice from the right people. One of the disadvantages of rapidly evolving technology is, as I had said earlier, everybody just looks up something online and believes it. So going to the right people, going to the right experts, I think is important. Trusting your healthcare providers, your doctors, and people that really care for you and your family. If they're trustworthy, going by that rather than just looking at whatever is the latest trend. I think that is important. And we talked about pollution and staying away from that, I think is key. These are some of the suggestions I would give.
Yeah. So don't make Google your doctor. Go to a
Or ChatGPT.
Yeah, or ChatGPT. Go to a health practitioner.
Yeah, go to a trusted practitioner. It's always good to be informed. So make no mistake. I'm not saying that people should not know about themselves. You should certainly be self-aware.
Yeah.
And you should certainly be taking all steps to make sure that you are taking care of your family.
Yeah.
But at the same time, everybody has their own area that you specialize. You yourself are very good at your job, what you do, but you're not a doctor.
No.
I'm not doing your job. So in the same way, you cannot do mine. So if it comes to a healthcare situation, go to your trusted doctor.
Yeah.
And if you feel that something is not working out, you can always choose alternatives, but don't go with Google or ChatGPT because you may get burnt.
Yeah. I think that's the one little drawback of technology. Like they go hand in hand. It has its pros and cons.
Absolutely. And when it comes to something important like healthcare, it is not like just buying clothes or watching a latest show on OTT, but healthcare is something that is very important, and you have to make sure that you have the right information.
Yeah.
So by all means, get self-educated and be self-aware. But talk to your trusted doctor.
I mean, you have spent years in the industry. I mean, you have a lovely profile. So I think listening to a doctor, getting advice from a doctor weighs a lot more than AI.
This is true. True. And we have seen it. I have seen it personally over the years. From the time the internet revolution started, it has swung back and forth. But as you said, you can get easily misled.
Yeah.
And with the last, maybe I would say 10, 15 years, the explosion of social media has made it more complicated.
Yeah.
It is not just reading on Google. Everybody will read and then they'll post it and repost it. And then, I don't know if you remember when we were children, we used to play this game where you'd sit in a room and you'd whisper in the ear. And you have to say that Chinese whispers, right? I don't know why it's called Chinese whispers, but you won't go there. What happens is when you finish the circle, the statement that you started off has completely changed.
Yeah.
That's what's happening on social media now. When you post and repost, you put your own little spice into it, your own tadka, and that can change the picture. But that is where misinformation comes in.
Correct.
And in healthcare, that is a real danger, and that can actually come in the way of your healthcare. So once again, that is why go to your trusted doctor.
Yeah. Misinformation can be really harmful.
It is.
Especially when you're dealing with children. Yeah.
Which is correct.
So as you rightly said, misinformation is equally harmful. And, Woman Ki Baat is a platform where we come together, we share some truly insightful things so that our audience can also learn. Thank you so much for coming on the episode today, Dr. Sankaran. We're really happy to have you here.
It was my pleasure. And even though it is Women Ki Baat, this is mostly Children Ki Baat. So I think women and children.
Yeah, of course.
So it was my pleasure being with you here today.
Thank you so much.